Welcome to this PowerPoint about the Cardiac Science G3 automated external defibrillator. It's really simple to use, and as we go through these next 10 slides, I'm going to talk you through all the different components. But if you do find somebody in cardiac arrest, the AED is one of the best tools that you can have to restart the heart. So that's why we've got the little symbols up there: get help, start CPR, and then shock the patient. And we'll talk you through that as we go through now. So first thing we need to do is make sure our AED is always ready to be used. And the first check is looking at the outside of the AED. Has it got a green light on it? So you can see the picture up there, and here's this one here. Look for this green light on the outside. Other checks you can then do is having a look at the scissors. It should be in the little side bit there, which is great. And then in the back, you may have some additional equipment. And what I've suggested on this list here is that you check the scissors are there, because you might have to cut away clothing. There should be a nice little cloth in case there's perspiration, the patient is very sweaty. A razor to shave excessive chest hair, and you only need it for excessive chest hair. And you might want a sharps container for that razor. And then if you are going to do full CPR, you might also then like to have a barrier for mouth to mouth. You may also find some spare pads, but you'll notice that there's a little window on the outside, so you can keep an eye on the date, the expiry date of the pads. So a couple of pre-checks: always make sure your defib's ready. And I think it's worth noting that your AED, the Cardiac Science G3, will do its own self-checks every 24 hours. And if there's a problem, then the light changes and it's no longer green. But if we look here, we can see how this light here has gone to red, and that means there's a problem. There's only two problems that can exist. It is either the pads are not plugged in, or the battery is not in, or the battery's gone flat. So it's either the pads or the battery. Let's move on. Okay, so in this one here, we're talking about now starting to use the AED. So there's a couple of things you need to do. First of all, an automated external defibrillator should only ever be used in a patient who we deem is in cardiac arrest. So whatever training you've already done to identify, it'll probably be something like checking to make sure it's safe for you, then checking the level of response of the patient, and then maybe opening their airway and checking to see if the patient's breathing or not. If the patient is breathing, you do not need an AED. But if the patient is not breathing, they are then deemed to be in cardiac arrest. At that time, you should then send for help and also ask for the AED. If you already have the AED on you at the time you find they're not breathing, you can put the AED on straight away onto the patient. If not, somebody should start CPR while somebody else goes to get the AED. And as soon as the AED arrives, you can then put it on the patient. The first thing you're going to need to do is cut away clothing, so you're working on the bare chest. This is when we look at the 5 Ps and the H. If there's perspiration, we then need to dry the chest. If there's pendants, we need to move that jewelry. If there's patches, we need to remove those patches or plasters. And if there's a pacemaker, we need to avoid that pacemaker site. They're normally on the opposite side to where we want the pads. If there's any bodily piercing in our way and we can remove them quickly and easily, then we should do. And we only shave bodily hair if it's excessive and where the pad's going to go. Once we've prepared the body, we can then apply the pads. It is simple. Once you open up the Cardiac Science G3, you open it up, it will switch on, it will start talking to you, and I'm going to demonstrate that in a second. You then remove the pads from the lid. They stay connected. So they stay connected, but you take the pads out, tear them open, and they're double-sided sticky tape, and then you apply them as shown there. So the next thing I'm going to be doing is opening up an AED, and we'll be able to hear it talking to us. So let's have a listen. Here's my AED. First thing is poppers on both sides. That drops down. We then have the AED itself, and then you've got this little button on the top here. As you press that, the lid will open and it will start to talk.
Tear open package and remove pads.
So these are the pads.
Tear open package and remove pads.
So it tells us what to
Tear
do.
open package and remove pads. Peel one pad from plastic liner.
So there's a tear.
Peel one pad from plastic liner.
And then the pad comes
Peel
off of the
one
blue.
pad from plastic liner. Place one pad on bare upper chest.
So we can
Place
see where
one
that
pad
would go.
on bare upper chest.
So it would go here, obviously on
Place one
bare
pad
skin.
on bare upper chest. Peel second pad
That's on the
and place on bare lower chest
patient's
as
right.
shown. Peel second pad and place on bare lower chest as shown. Do not touch patient.
Okay, so that was the first bit. And you make sure you get the pads right in the right way. There are pictures. So one pad will go just below the patient's right collarbone and the other patient underneath the left armpit. Let's move on. So the AED, you heard it tell us not to touch the patient. So whoever's doing chest compressions must now stop. The chest compressions can still go on whilst you're putting the pads on. That's okay. But when the AED says to stop, it's going to analyze. So that is when you need to stop doing chest compressions and allow the AED to analyze the rhythm of the chest. The rhythm of the heart to see whether it's shockable. Not all rhythms are shockable. We'll talk about that in another couple of slides' time. So let's have a look what we're going to do next. If it's a shockable rhythm, then the red light will illuminate. It only illuminates when it's a shockable rhythm. If you can't shock the patient, the red light will not illuminate. When it's illuminated, if you press that button, it will deliver a shock. So you need to make sure that nobody is touching the patient. And when it's completely clear, you will then press that button. It will then send the electricity through the heart to try to stop the fibrillation to allow the heart to restart. The body will jump. Immediately afterwards, you're going to start chest compressions again. So as soon as it's done, you start chest compressions. Do not wait for the machine. It will tell you to start chest compressions, but you must get on with chest compressions straight after that shock. If the machine says no shock advised, then you get straight on with chest compressions, and you'll be doing those chest compressions for 2 minutes. And there's a little screen on the AED which will count down the timer, so you'll be able to see how long you've got left until it analyzes again. And there's another little clock on there which counts upwards for how long in total the AED has been switched on, and it will also count the number of shocks that have been delivered. We'll have another look at those in a moment. So let's just talk about the heart. So the actual heart itself is a unique muscle. It's an intrinsic muscle in the body, and it works all by itself. It works through electricity. When the electricity goes through the heart, it causes the top chambers to contract, pushing the blood through to the bottom chambers, and that they then contract, pushing the blood out of the aorta and around the body. If that's all working normally, it's what we call normal sinus rhythm, as you can see in the very top corner there. And that would be normal sinus rhythm. But when the heart goes wrong and it's not beating normally, which would be 60 to 100 times a minute, it then stops beating and it fibrillates, which is like a quivering. So you can see that one in the middle is called ventricular fibrillation. The heart is quivering. Because it's quivering, blood does not get pumped out of the ventricles of the heart, so blood is not circulating around the body. So this person would collapse, and that is what we call cardiac arrest. So the heart has stopped pumping, but it's now fibrillating. That is a good thing because it's the only thing our AED will analyze. And if it's fibrillating, it suddenly gives it a shock, and that gets it beating back into the normal sinus rhythm. If that fibrillation slows, and then stops, we then get a systole, sometimes called flatline, and that is when our heart stops. So it goes beating, normal, person's alive. It goes into fibrillation, that is when they collapse. This is now cardiac arrest, and then that stops, nothing's happening, that's a systole. If the AED pads pick up anything different than ventricular fibrillation, it will not shock the patient. So the AED is designed to only pick up ventricular fibrillation. It also picks up something called ventricular tachycardia, which is similar, but we're only going to worry about these three for today's presentation. So if your heart is in normal sinus rhythm or in a systole or something else, the AED will not pick it up. The AED is very, very clever, and it senses that ventricular VF, so don't worry. I could put an AED onto me right now, so one pad, and it would not shock me. I could put a live AED onto me, I could press the shock button, it wouldn't do anything. The button wouldn't illuminate, which is a really good thing. Okay, let's just go through the whole AED on the next slide. So I'm just going to make it a bit bigger. So this was our AED. As we said, we're going to check for that, making sure it's a green light on the outside. When we're ready, we then open it by pressing that button, and then it starts to talk to us. We notice that there's some checks that happen first across this bit here, and I know it illuminates. So we're going to get the pads
and remove pads.
So we already looked at the pads earlier.
Package and remove pads.
So they're nice and simple to tear open, and the wires on here.
Pad.
The
Peel
pictures
from plastic
are on
liner.
here. Both pads are exactly the
Peel
same
pad
pictures.
from plastic liner.
So one of them will come off.
Peel one pad from plastic liner. Place one pad on bare upper chest.
Straight on the skin.
Place one pad on bare upper chest. Place one pad on bare upper chest. Peel second pad and place on bare lower chest as shown.
So they're the two pads.
Peel second pad and place on bare lower chest as shown. Do not touch patient. Analyzing rhythm.
It's also saying
Do not
the
touch
same
patient.
things.
Analyzing rhythm.
So this now is
Shock
not a
advised.
light. Okay, so we're going to
Charging.
shock.
Stand clear.
See how it illuminates?
Push button to deliver
So make
shock.
sure everyone's clear. Push
Shock
the button.
delivered. It is now safe to touch the patient. Start CPR.
And on this
Give
little
30
screen
compression.
here, it will
Then
now
give 2 breaths.
says one shock, and it's a timer counting downwards until the next analyzing, and a counting upwards for how long the AED's been on. This will reanalyze every 2 minutes. Okay, so I hope you liked that little demonstration. So just to summarize this little presentation about using an automated external defibrillator, and particularly the Cardiac Science G3, first thing is, make sure you do your pre-checks, make sure the AED has the green light on, it's got up-to-date pads in it, and the battery's in correctly. The second thing is, you need to choose to use an AED, and they all work the same, but you would only ever put an AED on a patient who was in cardiac arrest, a non-breathing patient. And then finally, if you are going to use an AED, follow its instructions. Switch it on. In this particular case, it's by opening the lid that automatically switches it on, and then put the pads in the correct position. Make sure it's against bare skin, so it'll be just underneath the right collarbone, just underneath the left armpit, which is a direct line across the heart. You must do as much CPR as you can, but you stop the chest compressions when the AED tells you, because it's going to analyze the heart rhythm. The AED will only shock if the heart is fibrillating. If the heart is doing anything else, it will not shock. So don't be surprised if your AED does not shock. Continue with chest compressions until either the patient wakes up and they're obviously breathing, or medical help comes to take over from you. Make sure that ambulance is on its way as early as possible. Thank you very much for listening. We hope you enjoyed, and hopefully you'll never have to use an AED.